Hello and welcome to World Insight on CGTN. I'm Tian Wei in Beijing. We begin today's program with the rapid spread of COVID-19. China and Pakistan are neighbors and all-weather strategic partners. And that bond is more important than ever as today marks the grim milestone of 1 million coronavirus cases throughout the globe. In Pakistan, there are now more than 2,400 cases with over 30 deaths. And last weekend, Pakistan Foreign Minister welcomed an 8-member Chinese medical team that has come to fight the outbreak. China also sent crucial medical supplies, including 50,000 test kits, face masks, and ventilators to Pakistan. To unpack this act of solidarity, we speak to Pakistani Ambassador to China to find out more. Let's listen in. I know you worked late at night last night because a charter flight from China to Pakistan took place then. Tell me more about that.
This is a combination flight, you can say, because it has some crucial equipment which has been procured or purchased by the National Disaster Management Authority of Pakistan. But the overwhelming tonnage of the equipment and supplies consist of donations made by our Chinese friends and our Chinese companies who have been working with Pakistan. And it is a matter of great satisfaction for me to tell you that the donated items alone, the value of those is approximately 25 million RMB.
Wow.
It's a very huge contribution made by the Chinese enterprises.
What are among some of the items on the plane?
Some of the items which have been donated include crucial testing kits. They include the PPEs, some X-ray machines, and a lot of other equipment. It also contains a reasonable amount of traditional Chinese medicine also.
I see. So that's likely to be of some help, at least to the front line in Pakistan.
It will be of huge help, and this is not the only flight that we are operating. A lot of our Chinese friends have very generously promised many more donations, for which I would like to take this opportunity to thank our Chinese friends, our Chinese brothers and sisters, and particularly the Chinese enterprises. We are very grateful.
One of the most important things is social distancing. Madam Ambassador, I know you know this very well because you work with home country closely on this. But it's not easy for a country like Pakistan, huge population, different culture compared to China. What do you make of the debate going on inside your country about that?
It is undoubtedly a huge challenge for us for a very simple reason. We are a developing country. China is now almost on the verge of eliminating extreme poverty. We still have large areas where poverty exists. We have large rural areas. We have cities in which there are areas which are very heavily populated. There are sometimes small houses in which there may be 10, 12 people. Our population is still not 100% literate. So lack of education, lack of understanding of the disease, and also some taboos, and a lot of people are also scared. And because of that, a lot of people are not even coming out to maybe, report their symptoms. So it is a challenge. But under the prevailing circumstances, the government so far has done quite well. In one province of Pakistan, we have imposed a curfew, and we are trying to implement a complete lockdown. But practically, a complete lockdown in our case is not working for one very important reason. That is why we have not imposed it in other parts of the country, because a lot of people are poor. A lot of our labor force still depends on daily wages. a lot of short and medium scale businesses cannot afford to continue to retain the labor force or their workers because they cannot afford to pay them without actually having their businesses in operation. Therefore, the government has been very careful in allowing local businesses under strict regulations to open up for certain number of hours every day, and also is announcing to the best of our economic and ability to provide them with economic packages to support the small and medium enterprises, but also to directly support the families and individuals who depend on daily wages. So it's a very difficult balance that we need to maintain. The Prime Minister has also set up what he calls a youth tiger force against coronavirus, and this is especially a force to go and to create social awareness and to provide food and rations on a daily basis to families who depend on daily wages.
Madam Ambassador, you touched on a very important topic, which is how the cultural factors are likely to have an impact on the prevention and control.
Actually, as I said, we got a lead time before the virus came to Pakistan. So the government involved the Islamic scholars to come up with advice in the light of the religion on virus controls. Human life and prevention of epidemic is the most important. A Muslim can pray anywhere. He does not need to come to the mosque. So this is a message that has been conveyed consistently by the religious leaders and the government. So at the moment, the regulation is that not more than 5 people can be in any mosque at one time. But the clergy and the administration of that mosque has been given the additional responsibility to watch out for the community, because they know the congregation that comes, so they know them on personal basis. They know how many children they have, they know who's sick, who has died. So they have a very close everyday contact with them. So they have actually become a source of information and a source of prevention in the spread of this epidemic.
Very unique practice, but certainly helps.
Yes, absolutely.
Another thing is about testing. Now, testing kits, even inside the United States, which is a developed country, has been a huge debate. I would assume for a developing country like Pakistan, also difficult.
You're very right. The entire population cannot be tested. We are 230, 40 million maybe. And people are living in very remote areas also. And in any country, even in China, we saw that it was impossible to test the entire population. So learning from the Chinese experience, taking a page from your worksheet, we are also actually employing the same method. We are very closely monitoring the patients or the population that is showing signs of coronavirus or symptoms of coronavirus. And then we are trying to identify the person, test them, and if they test positive, then we trace the people that he has been in contact with or she has been in contact with in the last 14 days, and then we bring them in and we test them and put them in self-quarantine. We sent about 50,000 yesterday on our flight to Pakistan, but compared to the population size, these are still too few.
Yeah.
So we will have to take the methodological approach which China adopted. That is the only method that I think is feasible.
China was first in the fire. The guidelines the China Health Commission provided to the general public has been upgraded many times, 6 or 7 times already. So how do you think they can be of any help to you?
In fact, let me start by saying that it is not only Pakistan, but the entire world has learned from China. We were always also very carefully analyzing the practices of the Chinese government, of the Chinese hospitals, of the Chinese doctors, and all that material the embassy was summarizing, translating and transmitting to our relevant authorities back home. At this moment, my country needs us, and each member of my embassy has risen to that challenge, accepted that challenge, and we are working 24/7 to do everything we can. If we can save even one life with our effort, I think we will consider an achievement of our lifetime. And I'm very happy to say that we started the awareness program well before the epidemic or the cases of coronavirus started coming to Pakistan.
Tell me more about that.
Because actually, it's very interesting in a way, because we have a large number of Pakistan community here, of which 28,000 alone are students, of which approximately 1,300 students were concentrated in Hubei and about 1,186 in Wuhan and Jingzhou, and that evoked a lot of interest back in the general public. And as you know, the students in the beginning were very worried. They wanted to be repatriated, and you know, they were scared. They were not used to isolation and quarantine environment, and these are young students. They were worried about their families and very scared. So that brought the coronavirus to the doorstep of Pakistan in terms of information. So there were huge debates going on, and here from the embassy and the government was constantly engaging with the public on media and on the newspapers about what China is doing and what steps China was taking to ensure that Chinese people, but also foreigners, particularly the Pakistani people, were being kept safe. And they were again and again urging that this is a virus situation. It can hit any country. It can hit Pakistan also. So in Pakistan also, we should be aware of how to deal with it. So the general public, when it came to Pakistan, the general public to a large extent was already aware of what the disease is, what havoc it can create, how difficult it is to control it, and how important it is for the population to cooperate with the government and with the medics and hospitals. So there was already a lot of talk, and combined with that, it gave our medics, our doctors and our institutions to print out and prepare a lot of video and written material which they circulated to the general public. So there was already this awareness, and right now, like China did, we are also running a huge awareness campaign, and that is actually helping in a big way.
Because every member of the population is on the front line. The doctors are the last frontier, in fact, to guard. As a developing country, we all understand the resources limit.
Actually, again, we learned from China. Even in a country like China, where medical facility is very good generally, there was shortage of beds, and China came up with an alternate pattern very quickly. You set up temporary hospitals, you converted your gymnasiums, your hostels, your big buildings into temporary accommodation for quarantine, for patients of milder symptoms and medium symptoms. So Pakistan actually has done exactly the same. We have actually gone to the extent that for remote areas, because 70% of our population lives in villages, we have even converted rail bogies and rail coaches into temporary isolation units. we are also converting a lot of our government buildings, a lot of our schools, because schools are closed, universities are closed, their dorms are empty. That is how we are reducing the pressure on our hospitals, but still the pressure on our hospitals are still unimaginable. We have also asked all our retired doctors, retired nurses, retired paramedics to come and enlist as volunteers. We are also trying to look at the pattern which China followed of creating neighborhood committees to monitor residential areas and monitor people and report symptoms. That is also something very, very good which China did.
Community outbreaks.
To prevent community outbreaks.
China and Pakistan are longtime partners. What do you make of the practices and the performance lately between the two countries?
And your viewers may not know, so I was also here during SARS.
I remember.
I served here from 2003 to 2008, so I went through the SARS period too. And this time, I think China has gone beyond itself in trying to control this pandemic and come up with very good practices and very good protocols. Pakistan and China, we are all-weather friends. I think as President Xi told my president when he came for a solidarity visit 2 weeks ago to China, that gold becomes strong and shiny when it goes through fire. Our friendship has also gone through difficult tests and have again become more solid, more strong, more shining, and more ever lasting. At a time when there was a lot of politics being played on coronavirus, there was this very determined effort by some countries in the world to isolate China. We stood by China. We not only did not evacuate our people, we donated our entire stock of PPEs to China. Pakistan offered everything that it had. Similarly, our president made a very conscious effort to come and visit China, to show to the world that China is not alone, China is safe, China is a friend.
Madam Ambassador, I know your job is not just about containing the crisis from your perspective, but also to work on many other fronts of China-Pakistan relations and ties. Now, Belt and Road certainly is one of those very important ones.
As you know, the first phase of CPAC is almost near completion. 90% of the projects are already commissioned. The remaining are months away from completion. And when the pandemic happened in China, we consciously did not stop issuance of visas or put any travel restrictions between Pakistan and China. Why did we do this? We did this to ensure that the projects continue their progress and are completed on time. But secondly, because we, in consultation with the Chinese government and Chinese companies, put in place a double quarantine system. We arranged for quarantine of 14 days of Chinese workers returning to Pakistan after the New Year vacations. And then once they reached Pakistan, there was again a 14 days quarantine requirement to ensure that the other workers who were working in Pakistan do not get infected. And that system actually worked 100%, because there was not a single case of coronavirus that went to Pakistan from China.
Yeah.
And the projects did not stop either. And they will be completed and they will meet their deadlines, because this is an extremely important project for us. And if we need to recover our economies. So it is even more important that we ensure that this cooperation on CPAC, cooperation in Belt and Road, and the cooperation in the special economic and industrial zone does not stop under any circumstances. So far, the system put in place has delivered 100%, and we hope that it will continue to deliver 100%.